Before doing slit lamp examination, we need to do torchlight examination to identify basic facial abnormalities, eyebrow anomalies, and orbital anomalies. We need to keep the chin and forehead properly. As you can see here, the forehead is not kept properly. Similarly, check for the patient sitting position. The slit lamp rubbered markings should coincide with the outer canthus of the eye. For that, we need to adjust the knob and align it properly before examination. Start the slit lamp with the main power knob. The joystick is used to move the slit lamp up, down, forward and backward. In the slit lamp, we have aperture ranging from 1 to 14. We have 3 filters: yellow, blue and green. There is one target LED red light. There are 2 eyepieces with magnification of 10x and 14x. Both eyepieces should be aligned at 0 for emmetropic examiner, and myopic and hypermetropic examiner can adjust according to their refractive power. Slit lamp examination should start with upper lid and then lower lid. In lid, mainly we look for swelling, hordeolum, edema, entropion or ectropion, trichiasis, blepharitis, artosis. Second, we need to examine the conjunctiva. Start with palpebral conjunctiva, lower and upper both, then see the bulbar conjunctiva. Here we mainly look for papillae, follicles, discharge, congestion and hemorrhages. Next is slit lamp examination. We should go for the cornea examination. Start with the diffuse illumination to see overall structure, then make a slit and focus clearly from epithelium to endothelium. All layers should be visible clearly. To check foreign body, direct and diffuse illumination can be used. Examine the superficial layer of the cornea for SPKs or any corneal opacity. Then move to anterior chamber depth examination. For that, we need to make a slit beam near to limbus, focus towards the iris and study the depth of anterior chamber. To see Yaak-Pi patency, use a 3 mm aperture and focus the light in retroillumination. Locate the Yaak-Pi area and observe the reflected light from the Yaak-Pi. To see cells and flare, we have to use 1 mm aperture and maximum illumination we have to use. Pass the light from outer to inner margin of the pupil and observe the cells and flare in the anterior chamber. Finally, we should examine the lens. Examine the anterior lens first, then focus on posterior lens. The beam should be slightly wider for posterior capsule and then make it thin to examine the nucleus.